Hello, everyone. A very warm welcome from a slightly cold London. I'm Chris Van Tulloch, and I'm an infectious diseases doctor here at the Hospital for Tropical Diseases. I'm a BBC broadcaster, and I do academic work at UCL, where my research focuses on conflicts of interest. And that's why I'm your moderator for today in this, the second in a series of webinars about the problem with the formula industry. This event's in English. There's simultaneous translation in French and Spanish. And I want to say thank you to the World Health Organization, the British Medical Journal, the Partnership for Maternal, Newborn and Child Health, and CAP 2030 for co-hosting this event. In the first webinar, exactly 3 weeks ago, we spoke to health professionals about their personal experiences of formula milk marketing, how they came to recognize its power, how it affects all infant caregivers, regardless of how they feed their children. And if you missed that, it's the links in the chat and the recordings on YouTube. To be clear from the outset, once again, this is not a discussion about the benefits. Recording in progress. This is not a discussion about the benefits of any one way of feeding a child. We all know there are many factors that inform feeding decisions which are deeply personal. This is a discussion that seeks to support all families in their feeding practice. This is about protecting everyone from marketing that's driven by the pursuit of profit, not the pursuit of public health. So our focus today is very strictly on the marketing practices of the companies who make infant formula and their relationship with all of our different healthcare professional associations. So the question we're focused on is, should health professional associations refuse funding from the formula milk industry? And the answer feels pretty straightforward, but the devil's in the detail. There are lots of ingenious ways to move money around that feel like they might be okay. And saying no can be difficult financially, and it can also be technically quite difficult. So I want to highlight a few points in the webinar, which we talked about before. As individuals, the research is very clear that even as experts, we are vulnerable to the power and influence of marketing. The research also shows that very few of us understand just how vulnerable we are. We're exposed to thousands of ads every day. The formula industry knows that marketing works. It works on patients, and it works on us. And that is why they spend twice the annual World Health Organization operating budget every single year on doing marketing. The second thing they know is that people trust brands. They know this from their own experience, and they understand that we, all of us as individuals, but our associations particularly, are brands. In the UK, many of our associations have royal warrants, so they are brilliant places to put trust and value in partnerships. There's another starting point, which I just want to be clear on, that we and our associations, we've all signed up to a set of ethical principles that we've committed to. The associations also have the responsibility of supporting patients, and they influence guidelines. The formula milk industry is committed to a very different agenda. They have legal obligations to increase sales, increase growth, and increase profit for their owners, the shareholders. So their agendas and our agendas, they may feel sometimes like they're quite aligned, but they're not. They will inevitably collide. They have, and they will again. The aims are not the same. So we're talking about these two systems of influence today. There's the influence that we have and our associations have over governments, guidelines, patients, our feeding culture. And then there's the influence that the formula industry has over us and over those associations. If they become extensions, if our associations become extensions of the marketing divisions of those companies that do not and cannot share our aims, it will compromise the work that we all want to do. So I want to start with a video to remind us all about the people we're talking about, the people who are most impacted. Last February, WHO and UNICEF published a study that interviewed 8,500 women about their experiences of formula milk marketing. And this video shares some of those voices with their words read by actors. The video speaks to systems, those two systems of influence, the one that we have and the one that industry has, and how they intertwine to influence the decision-making of anyone who feeds children.
After I gave birth, they seemed to be fighting for the first sip of formula milk.
Obviously, we were looking online and that little advert for the same brand of milk just popped up. And with these cookies, I mean, they must know that we're looking at baby stuff.
I saw an advertisement on Facebook. The ad was eye-catching. Register immediately to receive 110,000 Vietnamese dong discount code.
I think that all those scientific acronyms like DHA give a feeling of scientific sophistication. You don't know what it is, but sounds cool.
I find those advertisements more reliable when there is someone with a white lab coat.
Yes, when mothers see the ad, they get motivated as they claim brain development, nutrition, and other benefits. Then the mothers think that if they feed this to their baby, then their baby will be healthy.
In the hospital, they say, when she is born, buy this formula.
I have been given a free sample at the hospital. I think that's a form of advertising.
I feel like part of the advertising is done by pediatricians because my pediatrician told me give him this milk and he gave me a free sample.
Stage 2 and stage 3. It's kind of like, let's continue your journey, let's help you. I felt like I was tricked into the full-on formula.
It's comparing it to breast milk. It's justifying giving formula because it's talking about how similar it is to breast milk.
I know formula milk is supplemented with various vitamins and nutrients and things. And it just made me a bit worried that maybe I wasn't giving him enough.
I do like the look of the one formula brand where it's scientific. It would make me feel like more research had been done into the ingredients that might be better for my baby. You know, we all want the best for our children.
Some really powerful words there, especially I think that idea of it being sciencey, of the packs now have the holograms and long acronyms that even many of us might not fully understand. Powerful words. So we want to address some of these tensions that we saw in the video really head on. And this webinar isn't about pointing a finger. It's about recognizing the scale of a problem and figuring out what the challenges are and how we can create a dialogue to move forward. So we're really lucky today to have the current and incoming heads of a number of very large health professional associations. First, I want to turn to Franca Cadet. She's the president of the International Confederation of Midwives. She's joining us from Belgium. Hi, Franca. Can you tell me about ICM's approach or your policy to taking funding from the breast milk substitute industry? How do you treat this with regard to other industries, say, like pharma?
Well, actually, what you were saying right at the start, that we refuse. I think as ICM, we're pretty clear. We refuse, but we don't. We don't take money, but it's at times quite hard because we are our member associations. And so we as ICM, we have several policies about breastfeeding, breastfeeding and HIV, about trade displays, exclusive breastfeeding, all kinds of documents that we support our members with, not to accept money or not to basically to promote breastfeeding. But our member associations are often very, very poor, and they're pushed in all kinds of ways to take funding for their local congresses. And so it's really difficult I just can't say to you, we actually refuse, even though our principle is to refuse, because refusing is virtually impossible for some of our members. And I personally when I was a midwife myself, I know I accepted certain things, which now I know were not acceptable. So, but as ICM, we refuse, but we can't totally refuse.
It's such an honest answer. And I think part of the difficulty with this discussion is stepping up and being straightforward about what you do and what's right and what the reality is. And then we can talk about how to get around it. So tell me more about the constraints and tensions that your association faces internally and externally when you're looking at sponsorship from BMS.
Well, as I said, during our congresses, we don't accept it, but there's many, many more things than that. And as midwives, we don't get much funding from, like, for example, the pharmaceuticals. Midwives are generally there to promote normal birth. And so we are not that interesting as a group by pharma and those kinds of organizations. So I think this industry, the formula milk industry knows that about midwives. And they also know that we're the people that are there in the community prenatally when we give advice, during birth, after birth. And so even though I, for example, as I said, when I was a midwife myself in the Netherlands, where people have all kinds of opportunities, I was really pro breastfeeding. And yet I had several sachets of milk in my bag with me, of formula milk, that were given to us by the industry. And I was told, and I'm not the most stupid person, but I was told, do that, because just in case someone needs it at night, then you'll have that little sachet. So I felt that I was being professional, even though I know now I was not. We had little plastic covers that the clients put their cards in, their own personal cards that they carried with them with all the data on it. That card had the name, and I won't mention the name, but had the name on it of a formula milk organization. And I did, I think, a few times say, look, should we be doing this? And I was told, yes, but if we don't do that, they won't be able to put their cards into a nice little plastic folder. And in that way, it sounds so small. But in that way, we get influenced all the time, even though you have your deep principles, because in principle, midwives really support breastfeeding and, of course, formula feeding if it's absolutely necessary. But breastfeeding is what we do, and yet still we get influenced all the time.
And do you think the situation is getting worse or better?
I feel in many ways it's getting worse. What I find with my colleague midwives as well is that when we're pro breastfeeding, we often get called the breastfeeding mafia. So when we are really pro breastfeeding and support women to breastfeeding, and actually what you're doing is supporting women, families, to give the best. I mean, if it were to be vegetables or things like that, we would be seen as doing the right thing. You're giving the best. But with breastfeeding, the pressure is on in a big way. And so we have to be so careful that people don't feel guilty. And this term breastfeeding mafia, I sometimes wonder why and how that got fed into society. Because as soon as you try to support women to breastfeed, and I often, certainly towards the end of my career, I used to say to women, well, you don't have to have any artificial milk in your house. You don't need to. You can always get it if you really need it in the end, but don't get it beforehand. But some people really felt this was pushing them. And I have been told that I'm a member of the breastfeeding mafia. And that's such a strange, I sometimes feel that kind of argumentation is fed. It's really, really hard for midwives. And I know some of our associations in low-income countries, they have very little money. It's like just a few midwives sitting around a kitchen table trying to organize the whole of midwifery within their country. And then they get told, oh, we can support you with this. And then that's the way that the formula industry gets in. And it's so hard to refuse.
I think your point about language is so important. The other even more offensive term that we have in the UK is the Bristapo. And where these terms come from is impossible to evidence. But this is a discussion where I think everyone, however they are choosing to feed their child, and I say this as a parent of two, however you feed your child, you feel marginalized and excluded and often humiliated. Franca, thank you.
Chris, can I just say one more thing? I actually sent a little Twitter message out just before this session, and I asked midwives to respond and said, look, what are your experiences? And this one person told me, her words are literally, as an editor for a midwifery journal, I was invited to attend an all expenses paid 5-star trip to see around a formula company abroad and hear lectures of how good they were with the aim to persuade us to advertise for them.
Wow. It's very hard to say no to that kind of thing institutionally or professionally. Well, I hope you've shared that on Twitter. I think everyone will follow you and have a look. Certainly I am. Franca, we're going to come back to you later in the discussion. I'm going to turn now. Thanks very much. And I think Naveen's screen is on. So I want to turn now to Naveen Thacker. He's the president-elect of the International Pediatric Association. He's joining us from India. Naveen, tell us about the IPA's approach to formula milk funding and about the challenges you're facing on this issue.
Yeah, so as IPA, our tagline, you can see working for every child, every age and everywhere. So we have always supported breast milk BMS code of WHO, and we have always worked with WHO to promote that. But before 2019, it depends also on interpretation, and I will be honest, as Franca, that before that we have accepted from foundations, not companies, but foundation, because our interpretation was that. But as soon as this was pointed out, we immediately stopped, and IPA in 2020 IPA Executive Committee has unanimously agreed that IPA will not accept funding from any BMS industry or any entity associated with it, maybe foundation or maybe institute. And so as of now, we don't accept any funding from any BMS, any entity. Then, as I said, we are committed to work with WHO, and we have supported through our work plan with WHO as a non-state actor. We in 2020 to 22 we had this element in activities. Now in the going forward in 2023 to 25, we have already our strategic advisory group on nutrition has a plan of collaboration which propose technical approaches to address potential conflict of interest between healthcare professional and manufacturers for food for infants and young children. But coming to the, as you said, the what challenges we face, as same as Franca, IPA is a umbrella organization of all pediatric societies. And only umbrella organization. There is no, everybody is under the leadership of IPA, 112 years old, from 160 countries. And while from lower middle income countries, there is, which, really have bear the brunt of the this violation of this code and these aggressive practices, there is a lot of support, and many of them, they feel this is more also not only policy but by law, but it is also by ethical and moral duty of IPA to support that, they feel. But we, as I said, we have member societies from everywhere and only one organization and running very successfully. So there are many other member society which have different views that we may not be affected by this marketing practices. And so there is not an agreement. And for us, we cannot force anybody, and we have to definitely listen to all member society. That's one thing. Second thing is, as Franca said, it's easy to it was always easy to get funding from either companies or their foundation in past, and it's very difficult to run a scientific meetings without funding. And definitely we may be better placed than midwives in getting other funding, but still it's a very limited space and getting more and more complicated. So these are the challenges which we face internally and externally. We cannot, we have to listen. There is a very strong feeling by that IPA should listen to the majority of member societies. And, there are large number of member society in Western world with they feel we are not influenced and we should have choice. So it's a really difficult situation for us. But as a IPA, we are very clear. We are not, we have a Congress in India. We are not accepting, we are not going to accept in 2005 in UK and also going forward, whether it is foundation, whether it is institute in any form. And we will discuss about how these, you are taken for a ride through different entities. So I think let's stop here. Yeah.
I think you've raised a point that we're going to come back to again and again. The notion of these foundations and ways of channeling money that feel more acceptable, and I think we need to be inspecting whether or not those channels do in some way launder or cleanse the money ethically and remove the benefit from it. Naveen, can you just give us a very quick sense of Where do you think most of your member organizations are sitting? Did I understand that the balance is that the organizations in the North, rich, West parts of the world are generally tending to be more comfortable with influence than those in lower income settings?
I will not say comfortable in getting influence, because that's they are very confident, whether any society, whether in West or East or lower income, middle income countries. I am very confident that it's not easy to and as a pediatrician, I am very confident it's not easy. I'm not saying impossible to influence. Like you cannot influence my decision, but they feel that there is a need for a more dialogue and more, if you have research, we have to show them, we have to have that. But it's not like, even in the Western world, there are many countries who feel that, we should have policy. And if IPA as an organization could take that stand, it could have never happened without, the support of everyone. So they are not opposed to it. And they are not supporting the companies, or they feel that they cannot be influenced. That's the thing. And when we talk about the measures, we have to see that if there is research, we have to show that and prove that it's happening, and then have a dialogue and create more awareness. I think it's a lot of homework. And we are very much, as I said, we have a WHO collaboration 23 to 25, and this is prepared by our Western colleagues only, who leads the SAG, and it is very clearly saying that we will find the technical approaches to how we can do that. So they are very much willing to be for this proposed technical approaches to address potential conflict of interest. So that's the thing. But I don't think that they are ready to be influenced. I very much object to that statement.
Okay, Naveen, thank you so much. Your passion is very clear in this area, and we've of course spoken about it privately. I want to turn now to, and Naveen will come back to you in the discussion later. I want to turn to Dr. Anne Beatrice Kihara. She's the president-elect of the International Federation of Gynecology and Obstetrics, FIGO. She's joining us from Kenya. You're in Kenya, aren't you, Anne Beatrice? Yes. It's very good to see you. Can you tell us a bit about FIGO's policy, the challenges that you face?
Okay, I will start right at the top. FIGO says, above all, do no harm. I know with breastfeeding, we tend to think a lot more of the neonate, but it is both the mother and the neonate that do have advantages from breastfeeding practices. In FIGO, the policy is very clear that one shouldn't entertain the BMS industry whatsoever. But it is converse. In fact, I actually support what my two colleagues have said. You have member societies. We have 132 member societies in the regions of the continent. And there is only so much influence you can give as the leadership at the top. And particularly, I really want to highlight the reality in low middle income countries, because I do belong to one of them. And the issue is, you have a congress, you have a training, you have some travel to be made. And these guys are so quick to come with the shillings. Really, it boils down to you and your individualized value system. Should I not? Because there is what you say at global level, what you say at country level, what legislature and policies do exist. In Kenya, it's very clear. Do not take BMS support at all. Do not be an advocate. But when you narrow it down and come to private public practices, you begin to see the cracks. We shouldn't have branding. We shouldn't have even the use of things like pacifiers. We shouldn't have bottle feeding. Yet the reality is different. The advertising, the marketing, even just looking at what you see on the usual televisions and what comes up on the social media really become really discreet, tempting issues. So we have this right from FIGO. We have this even very clear in some member societies within even low middle income countries. But as my colleagues have said, the reality is different. You even have the reality of where they may even select speakers to speak on nutrition. Yes, the policy may say no, the discretion should be at the discretion of your body. If you have to receive any funding, let it be an unrestricted fund where they cannot therefore dictate which direction it does go. But, so I will actually say, Chris, it is more complex than just straitjacket. It is a very complex entity, compounded by what is on your contextual front in your country, and more so what becomes the value system and even the experiential. I am a mother. When I look at when I was supposed to be breastfeeding, I was already in medical school. The challenges of tangoing, we didn't have baby crashes. We didn't have time out to actually, after the 3rd month, continue breastfeeding. So even putting the economics and the labor market and the environment, these are things that are strictly feeding into the same. What do you then do? What do you then do? And at the end of the day, you want the best for your baby possible.
How does your influence as president of FIGO compare over those 132 membership organizations in the region? How does your influence compare to the influence of the formula industry?
It's variable. It's variable, I have to be honest. There are some areas where you definitely have had the public messaging and the move towards that movement out of breast milk substitution. But there are other places where you really don't have much to say, particularly where they've percolated and marketed themselves and distributed coupons and even continue to support activities related to getting doctors into different outfits, if I can put it that way. So the workshops, the congresses, the traveling, it then becomes a catch-22.
And when you talk about the individualized values that help people make these decisions, how crucial is it that those umbrella leadership organizations, you're in the same position as Naveen, how important is it that you show very clear leadership about rejecting sponsorship in all its forms?
I think it's extremely critical, but at the end of the day, you can't lead and walk alone. You have to lead with others and walk with others. So you find at the very pinnacle, you are saying capital no. But when you actually do come into the member societies, in specific countries, again, the leadership in country does have a very strong bearing. We may give you the guidelines, we may give you the guidance, but ultimately the implementers must come from the in-country. And this is still influenced by the politics, it's influenced by the marketings that are going on from industry, it's influenced by even the individual who holds that key position.
And that's really clear, and thank you very much. We're going to come back to you in the discussion. The point about influence was made very effectively in the last seminar, that what we may well be looking at first is a cultural change to bring everyone around. And I think that's very much the spirit of these webinars, is we're saying we need to change our culture, and this is much more about carrots than sticks and changing minds and bringing people on board than it is about legislation and exclusion. So thanks very much for your words on that. I want to turn now to Karen Walker. She's the president of the Council of International Neonatal Nurses. She's joining us from Australia, where I guess it depends where you are in Australia, but it's late, I think. Neonatal nurses are so pivotal in those moments after birth. You have maybe the most valuable network to this industry. How has the Council of International Neonatal Nurses addressed this issue? What are your policies? What are the tensions?
Yeah, thanks, Chris. And just listening to my colleagues, that we have such similar problems. When I was first thinking about this webinar, I thought this was going to be easy, because our approach from the Council of International Neonatal Nurses is that we don't accept sponsorship. We did in the past, but our approach now is that we do not accept sponsorship from formula companies in any way. So I thought this was going to be quick, and that was the end of me speaking. But then listening to the others, we are a global organization. We have member organizations in more than 60 countries and national organizations. And I thought I would reach out to them to see what they actually do. Our last conference, which we can govern, was in New Zealand, and we certainly did not accept any sponsorship, and we won't in the conference planned in 2024. So that's pretty clear cut. However, when I talked to some of our national organizations, and an example, I went for a dinner after a conference in Africa, and we went to a dinner, and we weren't aware till we got there that it was actually sponsored by a formula company, which is sort of against what we would think. But our colleagues who ran it didn't see any issue with this. They said, well, we use formula, so why does it matter? We use drugs, they sponsor us, we use equipment. What's the difference being sponsored by formula? So then I thought I'd actually spread it a little bit further and ask some of my colleagues around the world what they were actually doing and what they thought. And my clear cut, definitely no, was very complex and diverse. And there's a lot of debate. The opinions range from more and more, there is less of a place, not none, less of a place for formula in clinical care. It's not the take home that we cannot take money from formula companies as it goes against best evidence, to it should be zero tolerance for formula companies. And then others, we use formula, what's the problem? Why could these wealthy companies not support our conferences, dinners, and education sessions? So really difficult and quite diverse from what I actually expected. And one of our big national organizations reported they actually promoted relationships with the formula company, and the reasons behind it was money. Like my colleagues have said, the formula companies will support sponsorship for education, activities, research fellowships, and conference funding. So I think our challenges are huge. The cost and the support of education is really important. And I think the others have said the same thing. Where do you get the money from? But from the coin perspective, we don't accept it. And our organization needs, I think, to work with others to actually support this.
Do you have a quick answer? I mean, have you wavered when you get those answers saying, what's the problem? We use formula. Has it made you waver at all, or have you developed a quick 30 seconds on here's why it matters?
Well, I think the research and the evidence is really clear to me, but I can actually understand where they're coming from, because if they've got no other source of funding, which we might have in some of our higher income countries, even though it's more challenging. So I can understand where they're coming from. So I think part of our moving forward, we need a big education session around and advocacy around why it is important not to accept it.
I really like that you mentioned the wealth of these companies. Many of them have, if we looked at their revenue in terms of GDP, they would be in the top half of wealthy countries in the world. So they have enormous wealth, and it can feel a little bit like taking a pay cut, that you end up doing work for free. And I think that's really hard for people. The flip side, of course, is we can, as I said, become extensions of their marketing department. And that's the other hazard, isn't it?
We can, and they can certainly bias what we say to parents with their marketing strategies. And if we've got people who are not quite are quite advocating for breast milk, breastfeeding, they can certainly be biased by what the companies do.
Karen, thank you so much for that contribution. We're going to come back to you at the end in the discussion, but I want to shift to part two of our agenda and talk about solutions. So in 1981, the World Health Assembly adopted the International Code of Marketing of Breast Milk Substitutes. It came out of scandals in the 70s. The term commerciogenic malnutrition was developed. Formula was being aggressively marketed in very low-income settings, and it was leading to a lot of infant death. It led to Senate hearings and the development of the code. And a series of World Health Assembly resolutions have provided further guidance. So in 2016, Resolution 69.9 specifically addressed the engagement of health professionals by industry, but it's been met by lots of questions from professional associations. I've spoken to the next two speakers about exactly what it means myself. And over the last 12 months, WHO and UNICEF have developed this draft information note aiming to bring clarity to what may or may not constitute BMS industry sponsorship and how associations should address these tensions and conflicts of interest. So we're going to speak now to Gráinne Maloney from UNICEF and Larry Grammerstrawn. Gráinne's a nutritionist, Larry Grammerstrawn's an epidemiologist, Larry's from WHO, and they're going to walk us through the context and the content of this draft information note. So Larry and Gráinne, over to you.
Thank you so much, Chris, and good morning from New York, and good afternoon to you all, and good evening joining online. So I'm going to talk by reminding us of what we understand by sponsorship, and then I'll hand to Larry, who will take us through what we can do moving forward. Next slide, please, Larry. So what we're illustrating on this slide that's about to come up, thanks, Larry. What we're illustrating here is that health professional associations have a dual responsibility to their membership on one hand, and to the populations their memberships serve on the other hand. At the same time, and which has been very well illustrated by many of the speakers previously, they are constrained by the funds available to fulfill both of those responsibilities. And therefore, when funds do come from companies such as BMS producers, this then creates conflicts of interest, which can result in the loss of independence, integrity, and public credibility, as this sponsorship can establish a visible reciprocal relationship between the company and the organization it sponsors, which then may be perceived as implying that the company or their product has earned a level of endorsement or an approval from the organization that it has been sponsored, that has sponsored it rather. So moving on to the next slide. So therefore, acceptance of funds other than from the membership themselves does create a conflict of interest, because it borrows or purchases some of the reputational trust that researchers and health professionals place in the host organization, which then can actually compromise patient care. And the reason it can compromise patient care is that studies have also demonstrated that health professionals exposed to targeted commercial activity have more positive attitudes to those products that are being marketed and are therefore more likely to recommend those to their patients. So therefore, they are giving a level of endorsement to those specific products. Next slide, please. So where does conflict of interest arise? So here it's very well demonstrated that it's in conferences. You can see the adverts here, high visibility presence, free gifts, sponsored dinners, again, as illustrated by the previous speakers. Through training, sponsored meetings and nutrition institutes, and then through research. And again, here nicely advertising different companies, and through sponsored journal articles. And actually, sponsorship is very common amongst health professionals, colleges and associations. And a review of related websites found that in fact over 50% of national pediatric associations report to receive funds from commercial milk formula producers. Next slide, please. Now, this is not something new. And in fact, this has been understood since the inception of the code from 1981, where it was stated that health organizations should not be used for the purpose of promoting infant formula or the display of products. However, it has been more refined and defined over time as the situation has evolved with subsequent World Health Assembly resolutions. You can see in 1996, it was elaborated that member states should ensure that the financial support for professionals does not create conflict of interest. And then much more clearly defined in 2016 with World Health Assembly Resolution 69.9, which many of you will be familiar with, where it really clearly identifies those risks and states that health professional associations should not accept gifts or incentives from companies that market foods for infants and young children, and that health professional associations should not allow such companies to sponsor meetings of health professionals and scientific meetings. So now I'm going to hand over to Larry, who's going to talk us through about what we can do next. Larry, over to you.
Thank you, Grania. So I just want to start to clarify about the code. I want to make clear that the code itself is actually not anti-formula. It doesn't want to prevent sales. It's not trying to prevent access to formula. It is a code about the marketing. And it makes a very big distinction between marketing and the product. And the aim of the code itself starts off saying that it is there to protect access to formula when it is needed, but it is also to protect families from the marketing that might dissuade from breastfeeding. The code is also recognizing the importance of health professionals. It's not just about the marketing in advertising and retail environments to the general public, but from the very get-go, 1981, it recognized that health professionals and their associations are the targets of marketing themselves and are used as conduits of marketing. So this is not a new issue. This is something we've been dealing with since its very inception. The code specifically called for the provisions that Grania just talked about. And so we wanted to get further clarification for people to really understand what was meant when we said in World Health Assembly Resolution 69.9 that there should be no sponsorship of health professional meetings or scientific meetings. So WHO, in collaboration with UNICEF, has produced a document on clarification on sponsorship of these meetings. That is open for public comment, will be for the next several weeks. And you can see on the right side of the screen here the short URL. So you can go to that and read the document itself, and you can enter comments about where you think we've made it clear, where we've actually raised new questions, things that need to be addressed within that. So it is open up right now for you to help us refine this document before we finalize it and disseminate it widely. The purpose of the document is to clarify what is meant. And we are hoping that it will also lead to discussion within your organizations. Those that were presented here today, most of you on the call today are members of different health professional associations. We're asking you to have this dialogue internally about what does it mean for us to not be sponsored. We're trying to provide the guidance around what we think that means, but we want your input on, have we gotten it right? The focus here is on the sponsorship of conferences, not all sponsorship of associations. We know that sometimes associations get money in other ways for other kinds of activities that they're doing. But we also know that a major part of that sponsorship does come in the form of sponsorship of meetings. And it's certainly the most visible form at which those companies are able to get their messages out to the healthcare providers. So just to highlight a few of the key things within that, one thing that the document does, besides really highlighting many of the points that Grania already raised about why we care about this issue, it really tries to unpack what do we mean by sponsorship of meetings. Many people just think about it as the direct funding that goes to the association. The kinds of things that we are a gold sponsor or a platinum sponsor by just giving a blanket donation to the organizing body for the conference, maybe to the association itself, for the purposes of the meeting. But it doesn't have to be that direct funding. It can also come in the form of in-kind donations, such as we're going to sponsor the luncheon, we're going to sponsor the break there. And so there's no actual money that exchanges hands. They're not handing money over to the association, but by supporting the various activities that are being done within the meeting, they are able to kind of get their name out there. Those can be kind of services that they provide, maybe a special room, maybe they sponsor the lactation room to show their connection to lactation. Their names might be on the gift bags that are given for all of the paraphernalia that are disseminated within the whole conference or the exhibit room, the merchandise that they're giving out for free. This can be in the form of advertisements in the program book. It can be apps. It can be projections that are shown on the screen at the beginning or the end of presentations, ways to get their name out there. And those might be purchased, but they are actually ways to sponsor the meeting. There are times that we often see that they're not saying we'll sponsor the whole event, we'll just do our own event. And so it'll be after hours, we're not actually there, but we're doing it separately. And yet we find that there's cross-branding. And so it's a way of bringing people to the conference and thereby subsidizing the conference in an indirect way. Sometimes they'll have their own sessions that are cross-branded with the program book telling about what's going on in the other. And so this is also a way of sponsoring the meeting indirectly. So we want to make sure that we're covering all of those. They can sometimes be providing scholarships for people to travel to the meeting, travel awards, registration support that will waive your registration fee if you want to come. So many ways that we see this in indirect ways, and we really want to reach out to you to hear other examples. Are there things that we've missed, ways that this sponsorship happens that you have questions about or that you think are concerning? A special issue came up within this to talk about exhibition space. We had a lot of discussion with WHO internally as well as at UNICEF to really understand, well, can we actually say they're not allowed, these companies are not allowed to be in the exhibition space? And that is certainly a question that every meeting will have to decide for themselves. But it was considered that it's difficult to say they're never allowed because the code itself does allow companies to share information as long as it is scientific and factual. And so is this an appropriate opportunity for them to do that? We might not call that sponsorship. Some people might say it's inappropriate for other reasons. It may not be the best way to get scientific and factual information out, but we couldn't really define it as sponsorship per se. However, there are many ways in those exhibition space that it really becomes clearly beyond scientific information, and by its very nature becomes more promotional. Some of that has to do with the size of the exhibits. Sometimes you see, just massive exhibitions of formula companies in the middle of the exhibition hall with fancy carpets and glitzy lights all over the place, and you really have to say clearly this is not just sharing scientific information. It could be about where they're placed. If they buy a space at the front of the exhibition hall that everyone is going to have to pass by and pay a premium for that, that's a way of sponsoring the meeting. If they're renting in ways that are not commensurate with other exhibits because they're getting something larger or a premium in some way. And also exhibition space can't be an opportunity for giving away gifts or trinkets or samples as ways to kind of give that extra bling. Those are also ways of sponsoring the meeting because they're using it clearly as a means for marketing their products. So I just want to close with kind of a call to action for all of you. Want you to have discussions within your associations. If you're at the leadership level, calling out to your membership and how they think about these and what the policies and practices ought to be. Or if you're within your association, call upon others to have these kinds of discussions and bring the leadership on board. Secondly, we'd love for you to be sharing what your organizations are already doing about this. There are different ways that associations are finding to fund their conferences by avoiding the sponsorship. And we know people ask these questions many times today in the presentations about how we know there is a need for funding. How do you turn away when someone is offering you free gifts? And we know many of you are already doing that in very successful ways. So please share your ideas among each other across regions around the world, across professional groups. We can all learn from one another. And just finally, again, please provide us your feedback on that information note using the link that was shared with you earlier. Thank you very much for your attention today.
Larry Grenier, thank you very much indeed for that thought-provoking presentation. So we want to move on. Larry and Grenier, are you going to stay for this presentation, or can we put a couple of questions to you, or are you going to stay for the discussion?
Yeah.
So I know there was a question from Rebecca Coombs, who's from one of the editors at the BMJ in their Special Investigations Unit. And she wanted to know, this is a provocative question, perhaps, or a ticklish one at least, is the World Health Organization itself in violation of the code because it accepted that funding from Nestle through its foundation?
Thank you, Chris, for asking the embarrassing questions at the very beginning here. And I think that the example that was just raised here is a perfect example of what you were saying at the very beginning about the devil being in the detail. We go with the best of intentions to try to follow the right policies, and then we find there are strange loopholes and legal situations that make it more complicated. So the situation that was raised was not actually a situation in which WHO accepted funding from Nestle. It was a situation in which the WHO Foundation accepted that funding. And it is an important legal distinction from a legal perspective, from WHO's perspective, and yet, as was also raised in the comments, not one that really makes sense. And we've tried to be very clear in WHO's policies and evaluating others that we don't make that distinction between a foundation and its parent organization. And yet, at the same time, our legal department was arguing that no, there is this separation, and so we've had to work through this distinction here. The WHO Foundation was established intentionally to be distinct from WHO, to give it more flexibility, to receive funding from the private sector, to give it a lot more, not be constrained by the same bureaucratic constraints that we have. And so it was supposed to be more open. And yet probably not open enough that it actually does things that are in violation of the World Health Assembly resolutions. But because it was legally separated, when we found out about this, WHO was very upset and said, "This can't happen. You have to reverse this now." And we discovered that we actually found that we had no legal way of forcing them to turn the money back or to change their policies. Since then, we have had negotiations, discussions about, okay, no, we can't legally force you to do that, but you realize you are using the WHO name and you are doing something that is in violation of what the World Health Assembly has called for. And I think we have gotten them to change their mind about this, and they said, okay, we won't do that again. So we think that we've resolved the problem. I still haven't quite seen the wording in their policies to make myself 100% sure this won't ever be an issue before. So we think we've corrected it, but we didn't correct it fast enough that they were willing to turn the money back and say we made a big mistake and changed it. So we're left with this mark against us that wasn't really WHO, it was another entity, but it was the complexity of these issues that we continue to have to fight, even within WHO that should have very clear policies. We got stuck in the same situation.
Larry, thanks for that detailed answer. I really appreciate that. Is this really important? That maybe is the devil detail that we sort of referenced at the beginning, that it seems very simple to turn down money, and then when it isn't entirely your own choice and there are other structures in place, it can become really complicated. And maybe that speaks to something I want to put to the whole panel about the idea of legislation versus culture, that is the most important initial change that we need, a general understanding that the code is a minimum standard, so that instead of approaching a document like the code as a thing we could try and work around or find clever solutions to, we approach it as, instead of a legal document, we approach it as having a spirit, and it's got a set of principles, it's a guidance. So I wonder if I can sort of start with Karen thinking about that. What do you think about the code as a minimum standard?
I think the code as a minimum standard is a good start, but I think with most guidelines and things, unless it's actually legislated, then and a legal requirement, then it won't actually get implemented as much. I mean, this guideline I think is really good because of the clarity that it's got in it. This actually says at the end of it that we should not accept sponsorship, and I think that's really quite direct and it's clear. From our professional organizations perspective, it's something that we will do from a COIN perspective, and we are currently doing, but our challenge is going to be get agreement from the members who currently accept sponsorship. So I think legislating it would have to be from individual countries as well. It's quite a large step.
Karen, thanks very much. We've got a really nice question from a young participant, Casey Birch, who wants to know how she can help to make a difference. I'm assuming Casey is a she. I guess it could be either. She says, I'm a student and I've been writing about the ethics of the formula industry for around 4 years. I'm going into public health infant feeding. I feel as though nothing will ever change. Formula companies are never legally held accountable for constant code breaches. Franca, do you want to re-inspire young Casey at the beginning of a career and maybe a few other people?
Well, the fact that Casey is asking this question is fantastic. Good on Casey. And the fact that she's writing and taking this seriously, good on Casey. And I think that we all need to do this. I do very much also agree with Karen. I think we need to legislate in some way. You know, we have the code. Yes, it should be a minimum, but there should be a way in which we can actually legislate. I at times feel that we should go towards the idea that formula milk is something that is given on prescription, given when it's needed on prescription, and so that people understand what it's for. It's there when it's needed, but not in other cases. There's all kinds of ways, and I know there is all kinds of lists of people who've broken the code. I think we also need to support people who are working on becoming better, because it's not a black and white picture. So organizations that have in the past, for example, taken money from the formula industry, who have now changed, let's find a way of saying, great, well done, good on you, and giving some positive messaging when people change, because I think that too really helps us to do it better instead of shaming. I think that might also be a way forward.
I really like that approach. I hope that is the approach we're taking today. Naveen, we've got some more questions from the Q&A. I want to know more about the relationship between the umbrella organizations and their member organizations. What are the opportunities for education through those umbrella educations? Lots of frontline health workers don't have the time to keep up with medical literature on the topic, and they may not realize its power. So how can umbrella organizations help?
Yeah, so I think, as Larry has shown that, that's the way forward. We have to create awareness, and that's really, we can do through our member societies, because we don't work directly through the pediatrician with the pediatrician, but we definitely can do more and more. And we have a definite plan for the next triennium, even with WHO and as a International Pediatric Association strategic plan to do that, to create more and more awareness in form of courses and orientation, guidance document. So there is definitely need. Can I also answer your legislation question, if you don't mind?
Yeah, of course.
So I come from India, and I will say legislation definitely works. It gives you a framework, but still there will be role of these guidelines and member societies. Like we had this legislation, and that was then Indian Academy of Pediatrics. My parent organization before I came to IPA, and still, they endorse very early, and they were working like Indian Academy, others were working like watchdog. So there will always be role. If there is legislation, it makes us easy who believe in this as ethically and morally. It help us in doing that. And when I talk opposite, when we talk to the other societies which are not following, they say it's not land of the law. How anybody can force us? So you got my point that it definitely helps if we have legislation in place, and then society, pediatric professional association, and everyone work together. So legislation definitely helps. Thank you.
So it's legislation clearly then is a way of enacting cultural change as well, and making it easier for everyone. And once things are in law, then they become much more widely accepted, don't they? We've got.
I think so. And if you see 69.9, it says the member states should enforce. So it's not only about these marketing practices, but also about the conflict of interest. So if it is in the legislation, it becomes, it's really, you can build on that. Thank you.
Naveen, thanks very much. Can I go to Franca? What should a membership organization, how do we have this discussion with an organization saying, look, we just don't have any other source of money. We want to get things done. We're trying to do the right stuff, but there is no other way of getting money. So we're in a low income setting. Is there an extreme situation in which you are able to say, well, this is the only choice?
Well, I would like to say there is no situation where it's the only choice, and especially in those situations where it would be the only choice, actually advertising for this industry would be the worst thing for the people who would probably also have very little money. And the best thing that they could give, which is sitting there for free, would not be given, and they'd be spending money and actually causing harm for their children. So that would be the right place to say no. But I think we need to kind of be in solidarity with our associations and find other ways in which they can then be funded. I do agree we need to have the conversations. I think as ICM, we really do have the hard conversations. But at the same time, I think we need to find a way in which we can then support organizations, or maybe find a way in which we can showcase them when they have said no, even though their situation is a really hard one. But at the same time, we are a members organization. We're not there as a police force. So we can't say to our members, oh, you've done a terrible thing. But we can say, look at the consequences, look at the ethical side to this. And how can we support you to not be able to take this funding, because this is not best for women, for babies, for communities. I think that's what we need to do. But it is hard. They are our members. They are the boss, actually. ICM is led by her members, as is IPA, as is COIN, as is FIGO. We are led by our members. So it can be really hard to be seen as the ones that are kind of saying, tut, tut, you shouldn't be doing this. But I do think that we can show by having the right policies, by not accepting the funding in the global situation, in our global conferences, not accepting the funding and walking the talk in that way, I think is a good way, and daring to have the discussions. It would be so great to have some kind of fund globally that could support these organizations so that they don't have to be kind of tempted by these kinds of organizations. Thank you.
Franca, thank you so much. Gronya, are you answering questions? I've got a slightly technically nutrition-y one. This might be one for you and Larry. There's a question from Juan Max Bertner, who says, I understand the code and all, but it's also true that the pediatrician needs to know details of all the different types of formula available for those cases that are needed. How should they get that information? Sorry, my questions have just updated, so of course it gets rid of it. How can we get that training if we're prohibited to even talk about the formulas?
I would say reach out to the clinical dietitians and nutritionists that work within the health sector, because they will have that information. They're trained to provide that information. So there are technical experts that can and should give impartial information about alternatives to breastfeeding as needed. So, and as a former dietitian working in the NHS, that's something certainly that I would have worked on in the past. That's why I sent the question to you. So just to be clear, a pamphlet from a sales representative or from an individual company that makes a particular product, you wouldn't say that's a great way of a pediatrician getting information about child feeding? Absolutely. Yes, absolutely. Go to the health professional that has the expertise to provide that information. Go to your dietitians, go to your clinical nutritionists. This is something we hear as, we went through this in the medical profession with pharmaceuticals. We've not quite come out the other end, but there was a sense of, well, we need information and they're a good source of it. I think we are now increasingly thinking that the best source of information is independent, ideally good big trials, lots of data, no industry funding. And that's where we get our information. We don't get it from sales reps coming to our offices and giving us pens. So Juan Max, thanks. I hope that does answer your question there. Can I make an addition there, please? Yes, please, and Beatrice. Sorry, your video wasn't on. I think it's critically important to really have a rethink even on the curricula. It's not just about the nutritionist and the dietitian, because when I look at when I trained and what constituted the nutritional training, particularly looking at breastfeeding and lactation management, a lot is yet to be provided. Number two is the siloed approach. I think this really speaks to us speaking to one another, right from the midwife to the pediatrician, to the nutritionist, to the gynecologist, moving out of the siloed care of a patient. The primary patient is our consumer of these services. So if we can actually have championing and a movement that is really integrated, I think we would move much further, which then speaks to our advocacy messaging, and particularly using leverage points, because there's so many
during immunization, during family planning, during childbirth, during the postpartum period. There are very many entry points that we could work and walk the walk together. I want to even bring to light, even having mothers who are professionals presenting to these conferences and breastfeeding their babies. I have had colleagues who've actually come into conferences with their children, and people look at them like, excuse me? But that is a very powerful message in and of itself. So even having baby creches, when we do have these workshops and symposiums, that would ring bells that there is value in having breastfeeding points readily available to actually give the best possible.
And Beatrice, thank you for those passionate points. There's some really interesting, nice point from an anonymous attendee in the discussion, just reminding everyone that when we talk about breast milk substitutes, we're including bottles and teats and the paraphernalia. It's not simply the product itself. So I want to, Naveen, can I ask a bit about how we navigate companies flying under the radar, supplying education for specialist formula, for allergy workshops, particularly in dietetics? How do we, that seems to me a weak point that I've noticed a lot, is that particular formulas are recommended for particular medical problems. And so that is the foot in the door. And we see that even with some professional associations in the UK, that there is a blanket ban on relationships with breast milk substitute providers, although it can be discussed whether or not there could be a stand at a conference about a specialist formula.
Yeah, so thanks for bringing that up, because I also wanted to say that, because what we have in information document, and there is no mention of covert sponsorship through many front organizations or companies that are not actually involved in sell up these products, but this has become a very clever marketing strategy and norm in, at least I know, in Indian subcontinent, like X company marketing, as you said, maybe some product, and another nutrition company as front organization for a sponsorship and doing the promotion. So this is very important. And we should know these tactics, and we should be able to face that and counter that, because that's very, very important. So these companies, they find a way to reach out to you, and we have to be very careful. So there is no way that special formula or that formula or say nutrition supplement. So all this is same as we said, you change the name and become a foundation or institute. And so this is all, same. And then they market something, under that.
It's a problem that's come up in the chat. Patty Rundle points about selling related products, not strictly under the scope of the code, probiotic supplements. And I think there's a lot of evidence that many of the claims made are ways of getting around some of the restrictions. A really interesting point, not a question, from Melissa Mialon, a nutrition researcher, who says, we know infant formula is an ultra-processed product. Are we going to protect babies' health any further and legislate? Parents may sue governments and professionals at some point if we don't protect them. I think it's a strong point that underlines the responsibilities and some of these reputational risks maybe that the associations face. They have a clear obligation, and there are known health risks. I think we've probably reached the end of the questions, unless there are any more. I'm trying to keep an eye on my WhatsApp and the questions pouring in the blog, but we're close to running out of time. Oh, sorry.
Sorry, may I just add something to what Anne Beatrice was saying?
Of course.
I think one thing that's really hard as well about what we see around us is that often women can't breastfeed, like in our congresses, etc. I think at ICM with midwives it's common, but I think with quite a lot of other ones it is not. But also just sitting on the street and breastfeeding, sitting in the train, sitting wherever, and just breastfeeding. And for that to be accepted by society. So the few things we can do, whereby we show the example. I remember a while ago in week 40, which is breastfeeding week, I published this photograph of myself feeding my son and my daughter feeding her doll. And I had long discussions with my comms team. Could I do it? Could I go onto Twitter with my breasts? And I was thinking, oh dear, this is the only thing that you can do. This is how you can walk the talk. But there we are so, I think that's also where we need to just go for it and walk the talk and show the example as leaders as well, not only in our policies, but also in what we do.
Frankie, can I ask, did you send the tweet in the end?
Yes, I did. I sent it in the WhatsApp group. I've sent that tweet. And I think, I've sent it in that group that we have all together.
Oh, okay, amazing.
Yeah, it's there.
Well, I will share it, and anyone can follow any of us to share it. Thank you for ending on that very personal note. There's one more question. Any possibility in the future to have a joint declaration coming from all the participant health organizations against accepting funding from the BMS industry? Larry, do you have a thought to wrap us up on that, a joint declaration?
I think it's the kind of thing that we would love to work toward. I certainly can't speak for each of the organizations here, but we have the essentially the federations of professional associations. So something like that would be very strong coming forward. I think we would love to reach out to each of the speakers today and say, see if they would be willing as an association to sign on to such a declaration. We also have next steps that WHO will be following through on to really build an action group to keep looking at this issue, bring experts together and members of associations to really try and figure out solutions. How do we address people's questions? How do we share examples and try and carry that forward? And we're hoping to have a meeting later this year among professional associations. Not every association in the world, that would be a massive meeting, but to bring key people together and say, what kind of declaration could we get? What kind of statements could they be making to really put their name on the ground and make this very public? We're opposed to this. We're ready to take action moving forward to really stimulate others to take that kind of action as well. So it is something that we'll be working forward on over the coming months.
Larry, thanks. That's a really positive note to sort of not end on, but almost to begin the next bit of work on. I want to finish. First of all, apologies that we cannot answer all the questions. There's, we've answered around 60 in the chat. There are around 50 that we're going to try and follow up as a group afterwards. I want to finish with a couple of thoughts, just to prompt everyone to think about our purpose when we're thinking about whether or not we're able to accept money. What is the role of the health professional associations that we're members of, or that we run, or we have membership associations? It's guiding medical education on professional standards, research and policy, leading the way in children's health. And when we work with these companies, we give them a halo and we donate our reputations to them. And as we've seen, there's an still unfolding scandal in the States. And so the reputational risk in practical terms is enormous for organizations that work for these large companies that do complex work and have this other agenda. There's two final thoughts. We know that all money is fungible. It's all interchangeable. So accepting money for one particular project can always be used for another project. And we know also that that money has influence. So I think one of the things for me that's become really clear, and that so many of our speakers have spoken to today, is this idea of there's always a loophole. There's always a shell company or a foundation or a way of laundering money. But having this cultural standard where we would like the code legislated, but in the meantime, it is a minimum standard that we're not trying to get around. We're trying to all interpret it as best we can and really, really limit anything that might look like influence. That influence takes many shapes and forms, but one of the key things is that it buys our silence. And you think it won't. You think that you can have a little stand at a side room, at a small conference about a specialist formula, and it won't buy your silence, but it will, because you cannot critique an organization that you have actively entered into a relationship with and expect to be taken seriously. Because when you open your mouth about an atrocity that company may have committed, that you may have witnessed, the obvious question is, well, why haven't you stopped working with them? No one will believe what you're saying. And being able to speak out at the moment is really important. We must be able to bear witness to the commercial determinants of disease that cause harm in our world. So this isn't anti-corporate, it's not anti-capitalist. It's that we all know that unregulated corporations have particular agendas. They can do enormous harm. History has proved this again and again. And we must see ourselves, I think, increasingly as regulators. And you can't regulate people that you have conflicts of interest with. So we must think about those commercial determinants of health. They're huge. I said last time, I want us all to stay a little angry, but not with each other. We've got to move forward. And Larry's and Grania, I think, have very big plans to reconvene this at some point. This is the beginning of a conversation, very much not the end. And this is about moving to a world where everyone has the maximum freedom and choice about how they feed their children, and the best opportunities to make the best decision for those kids that they can. Thank you all very much for listening. And this webinar is going to be posted online. I want to thank particularly our hosts, the World Health Organization, British Medical Journal, the Partnership for Maternal, Newborn and Child Health, and CAP 2030, and all of our wonderful participants for being with us today. And thank you all for watching.
Thank you.